Assalamualaikum and good morning to Madam Rodzia. We are from Group 2 and we will be presenting about non-maleficence. First of all, let me introduce our members. This group consists of Anastasia, Andrina, Darren, Azliona, Ayuni, and me myself, Akila. First of all, I will explain the definition of non-maleficence. Non-maleficence is the principle that there is an obligation not to inflict harm on others. It simply means to do no harm. In terms of medical ethics, non-maleficence is where a medical practitioner or healthcare staff must do no harm or allow harm to be caused to a patient through neglect. In nursing, non-maleficence means to avoid causing harm to the patient or harm patient intentionally, or a nurse selecting intervention that do the least harm to the patient and achieve beneficial outcome. For example, a nurse would perform multiple checks on the type of medication and the patient's name before giving the medication to the patient. Non-maleficence ought to be a simple ideal to embrace. The clinical procedures we carry out on patients, on the other hand, might be otherwise. For instance, we must take into account the patient's discomfort and anguish when placing a cannula. By performing them in the short term, we are harming the patient. The perceived and anticipated long-term benefit that these operations should produce is required to balance this harm. Hence, if long-term good results, short-term harm is permissible. By using qualified staff to carry out the procedures, making sure the patient is comfortable as possible, and providing support before, during, and after the harm caused should be reduced to the greatest extent feasible following the non-maleficence principle.
Hello, I'm Azlan Azarin with matrix number 82461. We present about Article 1. Ethical challenges of nurses in COVID-19 pandemic. This article discusses a problem among nurses and healthcare professionals during the COVID-19 outbreak. In this article, the part that is highlighted is the recorded act of non-maleficence. On this slide, it was claimed that some healthcare workers are assigned to perform their duties without personal protective equipment (PPE). Not only are these individuals at greater danger of contracting the viruses themselves, but they also put their families and clients at risk. This is the further descriptions about the previous issue, so I simplified it into this flowchart. When there's no PPE and nurses were subjected to work beyond their job description, that would induce moral distress. It will later then antagonize one of the basic principles of bioethics, which is non-maleficence. In these sections of the article, we reviewed the conclusions of a research study that was carried out among nurses during the pandemic. As can be seen, one of the most important findings is that several nurses had made the decision to neglect their patients. This action is against the ethical concept of non-maleficence, which states that one should not cause harm to other people. That's all from me. Thank you.
Non-maleficence is one of the main principles of biomedical ethics in taking care of patients. Based on the article, non-maleficence refers to when the nurses wear full protection when assigned to duty. It is known that personal protective equipment, or PPE, is worn to minimize exposure to hazards that can cause serious illnesses. The principle of non-maleficence can be applied to healthcare settings, not just patient care. Therefore, when working with any member of the healthcare team, it is important to remember this principle. In this article, it is stated that health workers who were assigned on duty without PPE were at high risk of infection, not only to themselves, but also to their families, patients, and other healthcare workers. Thus, this violates the non-maleficent ethical principle. Next, nurses also must choose the right interventions when caring for patients. The non-maleficent principle plays an important role in all nursing judgment, particularly in challenging circumstances. It requires that nurses must consider not only the immediate but also the long-term effects of possible interventions. Besides, nurses must choose treatments or interventions that will cause the least amount of harm to the patients. Fundamental aspects of non-maleficence include intervention should not be inherently negative, but if the action has negative consequences, the potential benefits must outweigh the negative consequences. Lastly, the article also stated that some nurses have a low sense of responsibility and negligence. According to the article, some staff work slowly while rescuing patients and delivering other nurses' activities that reflected a low sense of moral responsibility. These incidences potentially degrade the standard of treatment, cause harm to the patients, and violate the principle of non-maleficence. Negligence occurs when there is a lack of due care and a risk of harm, whether it can be an accidental thoughtless potential for harm or a purposeful irresponsible risk of harm.
On to the next slide, I am going to be discussing about Article 2. So I am Andrina with metric number 82420. The article below shows non-maleficence and the ethics of consent to cancer screening. This article is presented by Lot Elton on 2021. Based on this article, Lot Elton stated that even where screening programs are effective, it remains the case that a net aggregate benefit is compatible with harm to many specific individuals. It is worth noting here that his concern is with uncompensated harms. By this, he means harms that are incurred by individuals who gain no benefit from screening. In other words, all an individual who is diagnosed with cancer through their participation in a screening program may undergo painful cancer treatment where this harm is morally outweighed if the early detection of their cancer prolongs their life. For other individuals, however, screening leads to overdiagnosis, where the detection of abnormalities which would never have progressed to cause harm. This results in many patients receiving treatment that is medically unnecessary, such as cervical excision to treat precancerous cells which might have regressed spontaneously. He also stated that over-treatment has its own consequences, where women undergoing cervical excision, for example, are more likely to experience preterm labor. Therefore, that screening causes harm appears to violate non-maleficence.
Okay, next, according to Article 2 about non-maleficence and the screening, non-maleficence is sometimes overruled in a therapeutic medical context by a claim to a consent, even when a screening program has a population level merit. Non-maleficence in screening is an issue that cannot be easily ignored. Because, for example, we can rationalize amputating a patient leg if it is medically necessary to save their life. However, it will not follow the non-maleficent principle if we amputate two of the leg instead of one with the same benefits. In another words, harm is acceptable with evidence base following the non-maleficent principle. One possible approach that is screening-related damage can be convinced is when the potential benefits to a specific individual is balanced with the harm that suffered by the same person. However, screening information literature could make it clearer the fact that many patients believe that the invitation to screening is met with their best interest in mind, even though it is inevitable that some individuals may be harmed by the screening. Similarly, invitation to screening could stress not only that accepting the invitation is a patient choice, but also explain that patient may as well feel the pressure to take up the invitation made by their doctors. We could address this issue by providing meta-information that explain to the patient how the pragmatics of the screening proposal may affect or may influence their agreement or willingness to join the screening offer. Also, the problem can be improved by inform the detailed consent, improving the consent itself, and also allow the patient to make their own choice. Thus, the screening is more valid following the non-maleficence principle. Also, by improve all the problems, we can ensure that the screening proposal does not violate the non-maleficent principle. Thank you.
Hello, my name is Denonike Anangalang. I'm going to present the example of scenario in nursing profession of non-maleficence. As far as we know, non-maleficence is an act that nurse should not do harm or the least amount of harm to the patient in care. Nurse should not perform a treatment that result in harm to the patient. So there are two scenarios, which is scenario 1, a 12-year-old girl named Susanti came across a nurse asking for antitusif from the nurse because she'd been non-stop coughing for about 2 hours after her pharynx surgery. The medication does not listed on her prescription by the respective doctor. What should the nurse do? And the scenario 2, a 38-year-old woman GTP to 37 weeks with an uncomplicated pregnancy is completely miserable. She is bothered by swollen legs, back pain, intermittent contraction, fatigue, and is asking to be delivered. As a nurse, what is your complication? So scenario 1 action. A nurse should follow the prescription from medical officer, should follow a least harmful way to reduce the girl pain. For example, the nurse could suggest the girl to drink more plain water to reduce the inner inflammation on the pharynx side. The nurse should plan up another intervention which are simple for a girl to reduce the pain, such as the girl posture on the bed or the girl daily activities to reduce her pain. The nurse should ask to the respective doctor for the problem to be resolved. So scenario 2, the action is since the woman wanted to have continuous labor before the 39th week the fetus to being delivered, thus the fetus of the mother increased the risk. Without a medical indication, non-maleficence details that the nurse or medical staff cannot deliver head at the time. A nurse should come up for another intervention to resolve her conflict about her comfort on the back pain, fatigue, and intermittent contraction that she had. For example, the woman posture on the bed or reduce her pain by giving her ice packs and warm bag and another intervention.